మార్టిన్ రోష్ ఈజ్ అ వెరీ ఎగ్జాంపులరీ సర్జన్. 2006 నుంచి ఆయన రోబోటిక్స్ స్టార్ట్ చేశాడు. ఆయన 2006 అంటే మనకన్నా చాలా సీనియర్ రోబోటిక్స్‌లో. దాన్ని ప్రతి స్టెప్ ఇంప్రూవ్ చేయడానికి హాస్ వర్క్డ్ వెరీ హార్డ్. ఆయన ఒక్కడే, దాని అసిస్టెంట్స్‌లో ఎవ్వరు లేరు. 8 కేసులు చేశాడు. చాలా క్విక్‌గా. కానీ పర్ఫెక్షన్, సూపర్ పర్ఫెక్షన్‌గా చేశాడు. ఏ కేస్ చేసినా ప్రతి ఇండివిడ్యువల్ ఇంట్రెస్ట్, ప్రెసిషన్ చాలా ఇంపార్టెంట్‌గా ఆయన చేశాడు. ఐ థింక్ ఐ హావ్ టు లెర్న్ దట్ ఫ్రమ్ హిమ్. అలాంటి పైనీని కలిశాను. హలో, నమస్తే. దిస్ ఈస్ డాక్టర్ కిషోర్ కారమూరి, రోబోటిక్ నీ సర్జన్ స్పెషలిస్ట్. ఈరోజు నేను అమెరికాలో వెస్ట్ పామ్ బీచ్లో ఉన్నాను. నాతో పాటు డాక్టర్ మార్టిన్ రోష్ ఉన్నారు. ఈజ్ వన్ ఆఫ్ ద ఫేమస్ సర్జన్ ఇన్ యునైటెడ్ స్టేట్స్ ఆఫ్ అమెరికా. అండ్ ఇప్పుడు నేను చెప్పిన రోబోటిక్ స్ట్రైకర్ దాంట్లో హీజ్ అ పైనీర్. ఆయన థాట్ చాలా ఆలోచనలు స్ట్రైకర్ వాళ్ళు ఇంప్లిమెంట్ చేశారు. హలో డాక్టర్ రోష్.
Welcome to Florida.
Yes. So how do you balance your orthopedic and personal life in America? In India, it's difficult.
Yeah, I mean, I think in our world, it's all about efficiency, right? So we have to love what we do. So we get up early and start. But as you saw today, we've moved to the ambulatory care center. So it's decompressed my life a lot because 90% of our patients we can do in this setting and they will all go home the same day. So it shifts a lot of the burden from my staff and me rounding every day in the hospital. So I have more free time, as you would say. So we want to balance that. The other thing you want to balance is, every time you get to a level in your career, you have to challenge yourself. Otherwise, you're going to get stagnant. So you have to figure out what is meaningful, whether it's research, whether it's surgery, whether it's traveling, whatever drives you, and you need to pursue it. So I try to balance that. Obviously, health is important as well. So we want to keep an eye on that. But overall, it's a passion, and I think we all have it. And so we all want to improve our patients' lives.
So Dr. Roche is just not advising doctor, but any field. After some part of career, you should not be comfortable. If you are comfortable, it's not right, probably. It's whatever. So can you just tell about yourself, Dr. Roche? You are born and brought up in United States of America?
Yeah, I was born in Cork, Ireland. Emigrated. My dad, physician, came over to train ophthalmology. Lived in Boston for a while and then came down to Florida. So I really grew up in Florida. Went back every year to Ireland to the family and then did all my medical training in Ireland. And then did my orthopedic training at the University of Miami. So after that, I came up to Fort Lauderdale, did a fellowship with probably the best knee surgeon I've ever met in my career. He was very talented in soft tissue balancing, and he didn't have a lot of technology to help him. So he was quite good.
It's brain.
Exactly. He was a pilot. He was very meticulous in how he approached things. So he gave me the foundation. Then around 2005, I started working with a company called Mako Surgical. And in 18 months, we developed a robotic platform, implants, and we did our first surgical case for a partial.
So if I say that you are one of the fathers of robotic surgery and orthopedics, am I wrong?
Depends on what age you want to put me about. No, I mean, there were people ahead of me, right? So we had RoboDoc in Germany. They were working, Bill Barger and the team. We had Justin Cobb using the Acrobot with the Oxford in England around the end of the 1990s. But I think we were the first commercially successful platform. And from that, it's really grown, and it's been beautiful to see all the naysayers when we first started now all engaged in robotics and seeing the value for their surgery.
Is daycare surgery and joint replacement is going to stay, or are we going to go back? Experience, what does it?
Yeah, I think day surgery has done a couple things. One, we got lucky because it was promoted through COVID because no one wanted to be in a hospital. But we realized that one, the psychology of going home takes you out of a sick patient. Two, we saw our infection rate went down. And then three, people had a better experience. So in the US, we're shifting for physios to go to your house. And in the future, I think we'll have things called medical homes where we're doing half of the things in the house through virtual as well as physical presence. So I think it's been a very positive response. The key is the right team or the right technology to monitor your patients for the first couple of days. But I've been pleasantly surprised of the acceptance from the patients in the community, but also my vision of expanding this even more. So I think in the US, if you look, more and more orthopedic hospitals and physicians are investing in ambulatory care centers.
For your information, Dr. Roche, I have recently become an entrepreneur. I have started a transitional care center in Hyderabad. Yeah, it's one of the biggest transitional care center in India. I have started that.
Gonna take time, and all you need is a few successes for the other patients to want that kind of experience.
Yeah.
I agree with you.
Yeah.
Congratulations.
Yeah, thank you. And what do you, because I'm relatively young orthopedician when compared to you, and what do you suggest? See, I am not taking care of my health, but what do you suggest an young orthopedician, right, from training to work-life balance?
I think a couple things. I think, we all do it for the right reasons. We want to be the best we can. It's our passion. We want to help patients. And then you have to deal with the business side of things. And that's where the stress comes. So I've learned, if you focus and have to chase the monetary side of things, you're always going to be unhappy. So you have to realize that's important, but it's not the core reason why we're here. And I think you have to define your day and stay to it. Meaning you have to have time during the day, whether it's meditation or exercise or reading, something that takes your mind off the stress of the day. And of course, you need good partners so you can rest easy when you're away, that your patients are well taken care of.
Teamwork is always good.
Yeah, I agree.
Okay. So apart from orthopedics, doctors, what are your hobbies? What do you do in your leisure time? Do you have a leisure time?
We do. I mean, people always ask me, what drives you? And I said, the OR is my office, right? So, we get to innovate and think about how to make things better while we're here. My family's very sports orientated, so we have a strong baseball background. I grew up on the beach, so I swim, surf, dive, fish. So that's neat, most relaxing. And then I try to obviously exercise, weekly to stay at health.
So Dr. Roche, thanks for the time. I know you are very inspiring human being and a surgeon. Now I came to know that. So we'll try to balance, and I think all for the benefit of the patients. Thanks for your time, Dr. Roche.